Good morning, everyone. Thanks for tuning in for our 211 Counts online data dashboard webinar. For those of you that have been following our summer webinar series, this is the 4th out of 7 webinars that 211 Connecticut will be offering this summer. Our next webinar is how can you help update the information on the 211 database? And that will be offered next Thursday, August 23rd by Kate Quigley, who is 211's lead resource specialist. If you haven't already signed up, you can go ahead and do so right on our 211ct.org website via the professionals page, and I'll be sure to show you where that is at the end of this webinar. So once again, thank you for logging in. My name is Annie Scully, and I am a research analyst with United Way of Connecticut 211, and I'm really excited to talk to you guys today about our 211 Counts online data dashboard. So let's go ahead and get started. As a little bit of housekeeping, you guys are on listen-only mode today, so if you have any questions or comments throughout the presentation, you can go ahead and choose to chat or use the Q&A option to ask your questions. I'll be sure to leave some time at the end of the presentation to address any questions, but if it's a specific question, I'll go ahead and follow up with you guys individually if you have questions about our data or about community needs within where you live or where you work. So thank you again, and let's get started. So as a quick overview, just to make sure everyone's familiar with 211 Connecticut, who we are and what we do, to make sure you really understand what our community needs data means. 211 is a free, confidential information and referral service that connects people to essential health and human services 24 hours a day, 7 days a week, either online or over the phone. As you can see from the map, almost 94% of our country has coverage by 211, and we know that the states that are not currently covered or don't have 100% coverage are working towards that goal. There are more than 200 independently operated 211s throughout the United States, and many, like ours in Connecticut, are operated by United Ways. We're accredited by AIRS, which is the Alliance for Information and Referral Services. And what that accreditation means is that every year, our database of 40,000 programs and services is updated at least one time. So each individual resource is updated by our research team at least one time per calendar year. What that also means is that we use a standardized taxonomy system to categorize and to code our resources within the database. And this is important when we start talking about data, just because not only does that help categorize our resources and allow our contact specialists to make accurate referrals to resources in the community, but it really allows us to report data accurately and to be consistent with how we categorize needs. So I'll talk a little bit more about that later, but I just wanted to let you know that when we start talking about our top categories and our top needs in communities, all of those needs derive from a very standardized taxonomy system. For those of you that have been around for a while, you might remember us as InfoLine, which is how we began back in 1976 as a public-private partnership between United Ways and the state of Connecticut. And in 1999, Connecticut became the first state to use 211 statewide. And we're super lucky to have support from the state and from local United Ways to continue to provide this service 24/7, 365 to the entire state of Connecticut. So a quick snapshot of how much help we really provide and how many calls we get throughout a fiscal year. Last fiscal year, 211 handled more than 250,000 calls from Connecticut residents. And those calls materialized into more than 320,000 requests for service. So when we start talking about our data, we're going to be focused on those individual requests for service and not individual calls. And the reason that we do that is because an individual call can result in multiple service requests. For example, if I recently became unemployed, I might call 211 for help building my resume or for help looking for a new job and finding employment resources. But I also might be worried about a lack of income. So how am I going to pay my next rent bill? Am I going to need help purchasing food? Am I going to need help purchasing healthcare if I no longer have coverage? So that single call that may be derived because I lost my job could result in multiple requests for service and multiple referrals to resources throughout Connecticut. You might notice that our top resource, our top service request in FY18 was for housing and shelter at almost 100,000 requests, and just below that was requests for mental health services. And we'll dig a little bit deeper into community needs a bit later to show that while housing and shelter is our top Connecticut need, when you drill down into specific towns or cities or zip codes, that's not always the case. And that's one of the great features of our online data dashboard, is that it allows you to really look more carefully at the needs within your specific communities. You'll see to the right that there's a bar chart that shows our website traffic over the past few years. And obviously that skyrocketed. In FY18, we had almost 2 million hits to our 211ct.org website. If you're not familiar with that website, we have some great webinars that are pre-recorded on our 211ct.org website that will give you a quick overview of how to search and how to use that website to its full potential. But we're really excited that people are using it. We're really excited by the increased traffic. And one of our goals in the recent future is to be able to do more with our website data. So moving along, the reason you guys all tuned in today, 211 Counts. What is it? Why do we use it? And why do we think it's so important? So 211 Counts is a free public online data dashboard that depicts 211 service request data. It provides real-time, searchable, and visual presentations of our 211 CT call center data across 13 top service categories and 76 subcategories. So a little bit earlier, I talked about our taxonomy system and about the various ways that we categorize need and resources within our database. So we have more than 1,000 taxonomy terms that we use internally. So our contact specialist and our information services department is well-versed in how to code and categorize all of our resources. For the sake of our 211 Counts data dashboard, we've rolled those categories up into 13 top service categories and then into 76 subcategories within each category. And what we've done there is really tried to make them easy to digest and easy to understand so that people like you in the community, stakeholders, elected officials, people that are applying for grants, doing research, can understand really what those individual top categories mean and what it means when there's a request for service within their community. So 211 Counts was created by Health Communication Research Laboratory at Washington University in St. Louis. And we launched 211 Counts in Connecticut in June of 2016, but the data on our dashboard dates back to March of 2014. So it's real-time searchable data that's intended to not only inform, but to be used to address community needs. And that's something we're really going to focus on later in the presentation is, it's great to raise awareness about what your needs are, but how can you use that data to really make a difference and to really start addressing those needs within your community? So our 211 Counts data dashboard can be used to establish trends, identify statewide and community-specific needs, and allows you to filter by zip code, region or municipality, Senate, House, or congressional district, age and gender, and then to set your search to a custom or preset time frame. It also allows interested parties, stakeholders, and decision makers to analyze call data as recent as yesterday, which is a really important feature of the data dashboard, to study trends across time so you can compare 1 week to the previous week, a fiscal year to the previous fiscal year, month to month, or even day to day to really determine what the needs are and when they're arising in your communities. It allows you to make comparisons, to conduct community needs assessments, and to share information. Maybe just raising awareness about what your top needs are is your goal when you're using 211 Counts. So without further ado, now that I've given you guys a little bit of an overview of what the data dashboard does and why we think it's important, we're going to jump right into a live demonstration of 211 ct.211counts.org. So you can get to this site by typing in ct.211counts.org, or you can get to it via our professional page on the 211ct.org website. When you arrive at our homepage, you'll notice that in the top right-hand corner, you'll see total requests and total calls. So as we talked about a little bit earlier, the total calls refers to each individual call, but the request refers to the conversation and the needs that arise via that call. So when you call, what are you asking for, and what are our contact specialists helping you navigate and helping you connect to within Connecticut? All of the data on the dashboard is specific to service requests, so not calls. So the data reflected on this dashboard shows service requests. When you come to the homepage, the data dashboard is automatically preset to show data from the entire state of Connecticut for the last 365 days. But some of the cool filter features allow you to customize the view to look really more specifically at the top needs in your community or the top needs within a custom or preset time frame. You can also see that it will show you the date right here, so the service request from August 15th to 2017 to August 14th, 2018, and that's because we're set at the last 365 days. If I went in and I changed that setting to a custom date range, maybe I'm interested in the past fiscal year. So I could go ahead and toggle back to July 1 of 2017, through June 30 of 2018. Click that arrow. And now all my data is repopulated to reflect service requests for fiscal year 2018. You'll see in the upper left-hand quadrant the top request categories, and this shows our top 13 categories. This reflects 100% of our 211 CT our 211 call center call data for the past fiscal year. So these top service categories add up to 100% of our requests. You'll see there's also the option to display the information as a percentage, which is what we're seeing now, or as a count. So if I'd rather see the number of requests as opposed to the percentage of total requests, I can choose count, and that data will be repopulated to show the count. If you follow along your top service category, you'll see there's a number of subcategories within each category. So for housing and shelter, we can drill even deeper into what those various service requests were. So it could have been a request for shelters, for low-cost housing, for home repair or maintenance, for rent assistance, for mortgage assistance, and so on. To get even a better idea about what that category might entail, if you hover over each of the individual top categories or subcategories, it'll give you a quick description of what that really means. So when we're talking about shelters, we're talking about temporary housing solutions for adults, children, and families experiencing homelessness, violence, abuse, illness, weather extremes, or other events or emergencies. And as you'll see, request for shelter is our top service request in Connecticut. Some of you might know that we are the front door. 211 is the front door for the state's coordinated access network. And because of that, the role that we play in helping people that are homeless or imminently homeless immediately access shelter and enter into our CAN system, we receive hundreds of calls every day from Connecticut residents that are seeking shelter. You'll also see, if we scroll back over to our top categories, that there's two little figures. If you click on that, it will give you some additional information about the demographics of the caller. So not only how many people called, but who called. Were they male or female, and what was their age range? So sometimes it has to think for a little bit to populate that data, but you'll see for housing and shelter, almost 65% of callers were female. And if you looked at the age breakdown, about 25% of them were between the ages of 18 and 29. So sometimes you want a little bit more information about the caller that's making the service request to kind of inform the decisions or the research you're doing within your community. You can also choose to highlight a different top category, and you'll see to the right that subcategory section will repopulate to show the information specific to that top category. So we can go through and look at food, utilities, healthcare, mental health and addiction, and continue down our line. Every time you hover over a top category, the information at the bottom portion of our homepage will also repopulate. So you'll see here, maybe I'll try to zoom in a little bit for you guys. If you can see this map right here, this map reflects all of our health, mental health, and addiction service requests over the past fiscal year. The colors are meant to give you a quick picture of where the highest concentration of need is for service requests specific to that category. So the darker shades reflect a higher concentration of need, and the lighter shades reflect a lower concentration of need. The map is also overlaid with some additional census information. So if I hover over a specific town or city, we can see that it will show us the zip code, the number of requests, and then the adult population for that municipality. It also gives some additional census data such as poverty rate, the rate of unemployment, the percentage of individuals with less than a high school diploma, and then the percentage of individuals that are renting as opposed to owning homes or apartments. And it then compares that data to the state average to give you kind of an idea of where that municipality or how that municipality compares to the state of Connecticut. To the right of our map, we can see our top highest rates, which is specific once again to the category that we've selected. So for this situation, it's showing for mental health and addiction, which zip codes had the most requests during fiscal year 2018. So if you hover over the zip code, it will give you the number of requests and the population for that zip code. All the way at the bottom, you'll see requests by time. And this shows trends over time. So it compares our current year to our previous year. So if we start with the orange line, you'll see data from August 2016 through July of 2017. And then the green line will show data from August 2017 through July of 2018. So it gives you kind of a quick picture as to, you know, how did requests in this fiscal year for this stretch of time compare to a previous year. So now that we've kind of gone over the nuts and bolts of our data dashboard, giving you guys a quick idea as to how to navigate and use the various tools, we'll drill a little bit deeper into some of the trends that you can see pretty quickly with our data dashboard. And then I'm excited to talk about some specific use cases and talk a little bit more about how we hope that you guys can use this tool to really advance the work that you do every day. So I'm going to hover back over our housing and shelter category. And pretty quickly, I can see that this category all the way to the right, which says unmet, is highlighting something called rent assistance. So this is fiscal assistance for rent, mobile homes, lot fees, motel rental deposits, homeless motel vouchers, and other home-related payments and assistance. So our unmet needs category tells you out of all of the service requests we receive, which percentage of those requests were we not able to meet. And this is a relatively new feature on our data dashboard. And we think it's important because we want to know where the top needs are in our state or in our communities, but whether or not we're meeting those needs is extremely important. So as you'll see, 82% of requests, so out of the 11,000, more than 11,000 requests, 82% of requests for rental assistance in fiscal year 2018 for the state of Connecticut were unmet. And so that might leave you scratching your head a little bit. Why is that happening? But for those that are maybe paying attention to what's going on within our state, we can pretty quickly remember that in July of 2016, the state's rental assistance program closed their waiting list. So they're no longer providing that service. And unfortunately, that's the case a lot of times with our unmet needs data, is that the reason we're not able to meet a caller's need or to connect them to a resource to help them is because there's no resource available, either because their eligibility requirements are such that they don't qualify, maybe they have a transportation barrier that doesn't allow them to get to that resource. But for the most part, it's because there's not a resource available to meet their need. And that's where you come in. That's where people that care about their communities and are looking to advance the health and well-being of individuals in their communities can really use this data to make a difference and to expose need and to talk about how we can address those needs. So now I'm going to jump back over into our PowerPoint and I'm going to talk to you a little bit more about some use cases and how we really hope that you use our data dashboard. So we hope to use it for grant applications, for legislative testimony, for community needs assessments, for research briefs and reports. We get calls periodically from journalists that are writing new articles that are looking for some data to pepper their articles with. If you're looking for how you should deploy resources in your communities, or if you're interested in disaster response and how this data can inform decisions immediately. We know that it's real-time data as recent as yesterday. Every night we have a data transformation which occurs, so all of our call data from that day is uploaded into our 211 Counts data dashboard. So if you log in the following day, you'll see data as recent as yesterday. So now that we've talked about generally what some of these use cases are, I'm going to give you some specific examples as to how they've really helped us internally, but also stakeholders and interested individuals across the state to really advance their agendas or their initiatives using our 211 Counts data. So first, there's grant applications. So 211 Connecticut recently applied, or I should say in April of 2017, applied for a CHIFA grant. And within that application, we were able to quickly pull some stats right from our data dashboard. So in FY 2016, Connecticut 211 call specialists handled 7,795 service requests related to addiction and substance abuse, which is a 21% increase from 2015. So that quick stat was able to really take our needs assessment, which is a requirement for our grant application, to the next step. We used other data from the Department of Mental Health and Addiction Services and from various state repositories of data, but that quick stat right off the bat shows the real-time need that Connecticut had for some advanced opiate information referral initiatives within our state. We were fortunate to receive that grant, and we think that having some real-time data to be able to quickly compare actual needs, so actual voice needs that callers have when they dial 211, and we know that because of that quick stat that we were able to put into the introduction of our needs assessment, it elevated the level of our grant application. So the next use case is for legislative testimony. I want to say it was 2 legislative sessions ago, 2 colleagues of mine were giving a presentation to the committee at the the Health and Human Services Committee at the Capitol. And one of the members of that committee sat in on that presentation, and we highlighted our 211 counts data dashboard during it. And immediately after, Senator Moore, who is the representative from the 22nd district, came up to one of my colleagues and said, "Hey, I'm about to provide testimony, and I have no data to support what I know is going on in my town and city. There's individuals that are being evicted from their homes because they're unable to pay their water bills. And we're realizing that maybe your data dashboard could give us some data that could help to elevate my testimony. I've talked to my constituents. I know it's a problem for them, but do you have any data that could really help to enhance my testimony?" And pretty quickly, we just logged on to 211counts.org, and we're able to help Senator Moore add some concrete, some objective data into her piece of testimony. So 211 has received over 503 requests for assistance with utility bills, and they were unable to assist 67% of those requests. So once again, this is a situation where utility assistance is a need that many callers have, and because there's no state program to help with that, or there's no funding available in the communities they live in to address that need, we're unable to meet that need. Because of the level of detail you can drill down into under our data dashboard, we were able to, or Senator Moore was able to pinpoint the number of requests just for her district. So there were 46 requests just from her district, and 96 could not be met because there was no resource found to assist them. So this, once again, in addition to having a strong stance on why this there's a need to address the growing concern of foreclosed properties because of delinquent water bills, this 211 counts piece of data helped to elevate her testimony to make it stronger and have more concrete reasons as to why it was important. So for community needs and assessment, the data dashboard gives you a quick snapshot of the top needs in your community, but maybe you want to take it a step further and really drill into what your community needs are, and have maybe a quick one-page handout or a flyer that you can present to someone that you're trying to communicate the level of need in your community to, or that you're trying to make available to the public so they have a better understanding as to what the needs are in their community. So the city of New Britain recently did a quick one-pager, and on the second page of that one-pager, they used our 211 accounts data to make a quick fiscal year 2018 and 2018 comparison of need. So they made a couple of charts. They took their top service requests and compared them line by line. And then they used our additional data, so our demographic data about male and female, and about total about age requests, to really paint the picture as to where the top needs were and who the individuals were that were expressing the most need. They also had a category for unmet needs. So pretty quickly, an individual that was wondering, whether or not the needs were being met could filter through that top unmet need category and see where maybe there is a need for the deployment of resources. Maybe there is a conversation that had to be had with an elected official, or with a stakeholder, or with a local nonprofit that did work in that space. So once again, you can use our 211 call data dashboard, 211 counts to help do quick needs assessments. The data it's accurate, it's up to date, and it's readily available for you guys to use. The next is for newspaper articles. Every day we get calls from journalists and from individuals that are maybe aware of trends throughout the state, or have concerns about mental health and opiates, and whether or not people are finding housing, and they're wondering, when people call, what are they calling about? And are they calling about housing resources? Are they calling about mental health resources? And I recently had a conversation with a journalism professor at Quinnipiac University who was interested in using the 211 accounts data dashboard with her students this fall. And during our conversation, she had some great questions about the data. She asked why was our request for housing and shelter so high? And I informed her that's because we are the central intake for the Coordinated Access Network. When looking at mental health and addiction, this individual also discovered that crisis intervention and suicide services there was a high population of youth that were utilizing. We're calling 211 because of that. And I informed her that we're the central intake for the state's mobile crisis for youth and adolescents. So looking at the data, sometimes you need a little bit more explanation, and that 211 Connecticut is able to provide. But sometimes that's a trend, or that's a concern that you're able to unveil via this data. So we hope that by using it and by drilling into specific towns and cities, you're able to get a better idea of what the community needs are, and also to maybe investigate as to why. Why is housing and shelter higher in FY18 than it was in FY17? And why is the unmet need for rent assistance? Why did it skyrocket after July of 2016? You know, maybe there's programs that have been cut or there's changes that have been made that are affecting the individuals and their ability to access resources in your community. So also for resource deployment, many people are familiar with Flint, Michigan, and how there was a water crisis, and 211 accounts because of the fact that it was real-time data. Individuals, stakeholders, elected officials, emergency management department was able to figure out where the highest need for things like bottled water and for resources to address an emergency was needed. 211 contact specialists in Flint handled calls, reported that data, and it was then populated on the data dashboard for individuals to drill down into and see, all right, so this town or this city has the highest need for water right now. So that's another area that we're excited that, you know, for disaster response and for deployment of resources, 211 accounts can help inform those decisions. So finally, I'm going to talk a little bit about our goals with the 211 accounts data dashboard. So goal number one for us is to raise awareness. We think this is a great tool, but it's only as powerful as the people that use it, and it only does the work that you allow it to do. So if you have, you know, ways that you can roll a quick fact or a quick cost fact into your into a piece of testimony or to an article or to a piece of research, we definitely encourage you to do so. Another thing is to increase and document use cases. We're always looking for examples of how you guys in the community are using our data and whether or not it's effective. You know, do you need more? Is there something we're missing? Is there something, a bigger picture or a bigger story that we can tell by making some enhancements to our data dashboard? Which brings us to number three. We want to dig deeper into our data. We want to have more filter options and additional breakdowns. Age and gender were recently released, and we think they're great additions, but we know we can do more. Number four is to incorporate our website data. You might remember from our opening slide that our website traffic is through the roof right now. And right now we don't capture the searches or the pages or the clicks that individuals make on that website, our 211ct.org website. So we're hoping to be able to incorporate that data into our data dashboard soon to tell a more holistic picture of, you know, why people are turning to 211 for help. And finally, we want to make more 211 data readily available to the public. So coming soon is a new tool called Socrata Citizen Connect, which will allow you guys to drill deeper into more individual requests for service, so one level deeper. So we have our top and our subcategories now, but we're hoping to have an additional layer to get more specific into needs, but also to eventually help to align resources and service requests. So have a map that shows, you know, where requests are coming in and whether or not there's resources there to meet those needs. So how can you help? You can raise awareness for us. You can tell your friends, your community members, your elected officials that this is a tool that they can use to help determine needs within their community. You can use the data. You can identify the top needs in your community. You can include 211 counts in your needs assessments, your grant applications, your project proposals, your news articles, and your academic papers. You can dig deeper into our data. You can reach out to me or one of my colleagues to ask questions or request specific data. You can identify ways to improve 211 counts like we talked about earlier. What's missing and how can we improve the data dashboard to make it as effective and useful as possible? And finally, please, please, please tell us when and how you use 211 counts. We think this is an important initiative. We think open data is important, and we think our 211 counts data tells a really important story. But without knowing how you guys are using it, it's hard for us to tell that story. So please don't hesitate to let me know or let individuals that I work with know how you're using the data. So that brings us to the end of our presentation. Once again, my name is Annie Scully. This is my contact information. Please don't hesitate to reach out. And I also like to open it up for questions right now. So you guys can choose the Q&A option and start asking questions. And we can also, if there's time and if people are interested, go back to our data dashboard and run some specific searches to show, you know, how to drill down to a more specific level. So if you have questions about the community needs in your town or city or your congressional district or your state house district, fire away and we can start kind of uncovering those needs. If you have more specific questions, please feel free to follow up via email and I'll be sure to get back to you guys. So once again, this is my contact information. My name is Annie Scully, and I'll be sure to send a copy of this slide deck to you guys after the presentation. But once again, as a quick reminder, Our next 211 summer webinar is next Thursday, August 23rd from 10 to 10:30, and it's how can you help update the information on the 211 database. So if you haven't already, don't hesitate to sign up. And thank you again for tuning in, and have an awesome day.